Dr. Michelle Jorgensen at Total Care Dental and American Fork, and this is another episode of Dental Mysteries Revealed. Today I'm going to talk a little bit more about what we talked about in the last video, function, or the way your teeth fit together. So there are some signs that I want you to look for to see if this is something that's a concern for you. First is the teeth themselves. So like I said in the last video, your teeth should not wear more than 1 millimeter in 100 years of life. So if you feel like you've lost more than that, then you're wearing too quickly. A lot of people will come and they'll say, my dentist told me that I grind my teeth. All right, that's a blanket statement that often isn't true. So let me tell you how you can find out, do you really grind your teeth or is it something else going on? So I want you to look at where the wear is happening on the teeth. Usually it's these front bottom teeth right here. Sometimes the front top teeth, but you have a harder time seeing that. I see that where people don't often see that. If you feel a groove on the back side of your top teeth or feel like they're getting thin or even chipping on the tip, that's a sign that those top front teeth are also chipping. It's just harder to see those. So I want you to look at the bottom front teeth. And if they are wearing down, what I want you to look at is where the wear is occurring. So if you feel like the wear is happening on a slope, so you're wearing the front side at an angle, the front side of those bottom front teeth, it means that your top and bottom teeth are too tight. Those bottom teeth are running into the back sides of the top front teeth, and there's no room for them to function. So it often pushes your jaw back. It gives you sore muscles here. It gives you sore muscles here. A lot of times people will wake up feeling tired, like they've been working out all night. Their jaw muscles are sore when they wake up in the morning. A lot of those kinds of things. So look for the wear. Is it on the front side of those bottom front teeth? If so, things are too tight, and that's something that needs to be addressed. Okay, if the wear is on just the top, just the straight top surface, and it's just the front teeth, it doesn't go into the back teeth, but it's just the front teeth, then that's usually something in the back doesn't fit quite correctly, and it's pushing that bottom jaw forward, and it wears the front teeth out. So people always say, I grind my teeth. Well, no, because if you ground your teeth, all of your teeth would be flatter. If only your front teeth are flatter, then it's actually a problem in the back. We talk about it's kind of like a rock in a shoe. There's a rock in your shoe back here that's not quite fitting right, so your jaw has to come forward to avoid the rock when it's chewing, and it wears the front teeth out prematurely. Now, let's go on to the next one. If you have flat teeth everywhere, and I have some people that do this, every single tooth in their head is now flat. There are no mountains and valleys anymore. It's all flat plains. So if you have that, then that is definitive that you do grind your teeth. Most people that come in and tell me they grind their teeth don't have that. This is a small percentage of the population. About 3 to 6% of the population actually do grind their teeth for no reason other than their brain tells them to do it. So if you have flat teeth everywhere, then you need some serious dental intervention because you're not going to have teeth left pretty soon. And I have pictures of people who don't have very big teeth anymore. So we do some either restoration where we rebuild the teeth, but also protection, because if you are going to grind no matter what we do, then we need to protect your teeth from it. So those are 3 things to watch for on your teeth themselves. The other one to watch for that you may not be aware of is gum recession. Now, most people that have gum recession that have been to another dentist that's addressed it will have often told them it's because you brush your teeth too hard. Well, this is one of those things that I always scratch my head at because it's usually very isolated, meaning you'll have a tooth right here that has gum recession, you'll have a tooth down here that has gum recession, and maybe the one right above it, but that's it. So I'll ask people, I'll say, well, why in the world did you pick just those 3 teeth to brush too hard? And they'll kind of look at me with, a confused question in their eyes. And I said, well, you didn't, obviously, right? You didn't just go, this one tooth, I want to have a receding gum, so I'm just going to brush it really hard. It doesn't make sense if you have just isolated areas of gum recession that it's from toothbrushing, because toothbrushing will see every single gum receded, not just 1 or 2. Usually what those 1 or 2 or 3 or 4 isolated areas are from the way your teeth fit together. If teeth hit too hard or prematurely, they'll actually flex, and at that flexure point, which is right up at the gum line, it'll cause the tooth to chip and the gum will recede. So if you have receding gums and it's not infection related, it's probably because something's going on with your bite. So I want you to look at gums as well. The last one I want you to pay attention to with bite, signs and symptoms, is your muscles. You should not wake up with sore muscles in the morning. Your jaw should not hurt. Your teeth should not hurt when you wake up in the morning. So I tell people, if you have sore muscles here, if you have sore muscles here, even down in your neck sometimes when you wake up in the morning, it's because you've been working out all night. If you were working out this arm muscle all night long and you woke up in the morning, it would be fatigued. And then you went to even try to pick up a fork to eat breakfast and it would be sore. That's why sometimes you get sore muscles when you chew food because they're already tired because you've been working them too hard. So if you have tired muscles when you wake up in the morning, things don't quite fit right, you just don't want to eat hard things like apples or carrots, anything like that, something's going on with your bite. So those are all things to look for. And the fix is something that we love to talk with people about because sometimes it's very simple. So don't be scared that it's going to be something really extreme or exotic to be able to get you fixed. A lot of times it's something very simple and we can help you get feeling a lot better. So I hope that this has been something that you've learned from today, and thanks so much for watching.